Hello viewers, this is Dr. Syam signing in today's Doctor's Voice. Viewers, today we'll get to know about two different topics. One is gastroenterology and liver related issues, and another one is medical oncology. We'll be discussing about on that part lung cancer and common genitourinary cancers. We have two different distinguished specialists from Singapore. On the first part, we'll be discussing about gastroenterology with Dr. Lui Hock Fong. Dr. Lui Hock Fong is a gastroenterologist practicing at Gleneagles Hospital, Singapore. He specializes in digestive disorder and liver transplant management. Dr. Lui trained in gastroenterology and hepatology at Lister Postgraduate Institute, Royal Infirmary, Edinburgh, and Scottish Liver Transplant Unit. Currently, he is serving as the chairman of National Foundation of Digestive Disorder. Dr. Lui, welcome to our show.
Thank you very much for having me.
Yeah, it's a pleasure. So, as we got to know, you have a special interest on common liver diseases. I would like to begin with that. So, what sort of liver disease patient often visit to your practice from this part of the world?
Yes. So, when we speak about liver disease, I think in particular chronic liver disease is a liver disease that is ongoing and can result in long-term damage, leading to serious complications like cirrhosis and liver cancer. And there are certain patterns and causes for this liver disease over the years. And recently, in the past 10 years, there is a shift in the type of liver diseases that leads to chronic liver disease. In the past, Western countries would have hepatitis C, alcohol-related liver disease being the common ones. From our part of the world is hepatitis B, sometimes hepatitis C being the common one. But nowadays, both East and West have a common enemy, and that's fatty liver, and that is fast becoming the common chronic liver disease that we are facing. So from our part of the world, we still see hepatitis B related liver disease, some hepatitis C, but fatty liver is now up and coming as a major liver disease.
So from East and West, both sides, fatty liver disease is a global challenge for the liver.
Yes, it is a global challenge.
Okay. So fatty liver disease, when we need to be aware of it, or when we need to be concerned about it?
Okay.
All the fatty livers, do you think harmful, or all the patient needs to be under follow-up? What do you think?
So fatty liver is a condition where there is excess fat in the liver. Our liver has some fat, and that is healthy because it is a source of energy for us to use when we're not eating. But when the fat is in excess, then it's called fatty liver, and it is of a few grades as the amount of fat increases in the liver. But what is dangerous is when the fat damages the healthy liver cells, leading to long-term damage and cirrhosis, and increases the risk for liver cancer. So across the board, about 30% of the world now has fatty liver. That means they have excess fat in the liver. But of these, only about 15 to 20% have the serious type of fatty liver where there is damage leading to chronic liver disease. So we should be, number one, aware of whether we have fatty liver. And number two, if we have the fatty liver, whether we have the harmless type, which is the majority, 80 to 85%, or the more potentially harmful 15%. And it is in this 15% that we pour in our effort to try to institute treatment to reverse or control the condition.
How can we prevent from our liver to get extra fat?
Yes. So fatty liver disease is a disease of lifestyle. The current modern lifestyle is not favorable to a good liver health. We tend to be busy nowadays. We don't exercise so much. We are often on our desk. There's often pressures from work, and then we don't eat well. We don't pay attention to what we eat, and we tend to maybe indulge more in alcohol. We eat rich foods which contains high carbohydrates. We take things off the supermarket shelves, which is convenient, but these are processed food, sometimes containing processed sugars, what we call fructose. All these are ingredients that promote fatty liver. So in order to avoid it, we try to sort of reverse these elements. We should have an active lifestyle with regular exercise, and then we should adopt a healthy diet where we watch the total calories of what we eat, and then we eat healthier options like lean meat, more fish related proteins, eat more greens, eat whole grains, what they call the Mediterranean diet. So this is something that will go a long way in managing and preventing fatty liver.
Okay, so as you were saying, it is a manifestation of a defective lifestyle. But is it related with any other health conditions?
Yes. So in addition to that, fatty liver can come about if the individual has some medical conditions, especially diabetes. Individuals with diabetes have worse types of fatty liver. If they have fatty liver, they're also more prone to develop more fat in the liver. The second condition would be less commonly seen, like hypothyroidism. That means we have inadequate thyroid hormones. Yep. Sometimes medications can also lead to fatty liver, but that is less usual. Some cancer-related medicine, for example, tamoxifen for breast cancer.
Okay. So what about the common enemies like hepatitis B and C? They used to be the most leading cause of
Yes.
chronic liver disease
Yes.
and cirrhosis. Is there any recent advancement against this virus in terms of treatment?
The short answer is yes. For hepatitis B, I think the most important advancement came about many years ago with immunization. By immunization of all newborns, we equip them with the antibody to prevent them from catching hepatitis B, and therefore the next generation will not have this problem. So immunization is very important. For individuals who carry the virus at the moment, they need to be treated, and we have very effective medicines that can completely control the virus, but they need to take the medications for quite a number of years and sometimes lifelong. The good news is for hepatitis C, we are facing the prospect of it being completely eradicated because we have effective treatment, which for 2 months of oral tablets, there is close to 100% chance of killing the virus completely. So for these two viral hepatitis conditions, we do face, we face a good prospect of eradicating them.
I see. So one more question, as your special interest is in liver transplant and all this management, when do you offer a transplantation in a chronic liver disease patient?
Transplantation is offered to a patient when we have failed in reversing the chronic liver disease with the best of our medications. So we offer transplant for individuals who have chronic liver disease that has progressed to the point that the liver no longer is able to serve the body, and if that carries on, the patient will suffer liver failure that is fatal if not given a new liver. And so that is when we offer transplantation. There are a few indications that tell us when that is coming on. So when we identify that, or when we think that the current medicine is no longer helping, even though the stage of the disease might be slightly earlier, we will offer transplantation. The second common indication for transplantation is liver cancer that is too big to be treated by surgery to offer a complete cure.
Okay. Can transplantation be a measure in case of acute liver failure or acute liver insult?
Yes. So the second group where we offer liver transplantation would be for individuals who develop an acute condition of the liver with usually severe inflammation. So this is no longer chronic liver disease but acute liver disease. It can be due to exposure to a medication that damaged the liver severely, such as paracetamol. Sometimes it's certain antibiotics, sometimes it's herbal medications. Occasionally, it's a very bad and fulminant viral attack. It can be hepatitis A, hepatitis E, and then occasionally we see rarer conditions, inherited conditions of the liver. In the West, where there is the mushroom season, sometimes they eat mushrooms which are toxic. So these cause the liver to decline rapidly, and reversal may not occur without a new liver.
Okay. So how do you treat a patient on post-transplant stage?
Yes. So the management of transplantation would be divided into pre-transplant, and then of course the transplant surgery and the post-transplant. Yeah, we have improved the management and outcome for transplantation, such that transplant surgery performed by experienced surgeons now enjoy a success rate of 95% and over. And then post-transplantation, the main emphasis is the first short-term period to prevent infection, to manage rejection, and then in the long-term period to maintain the absence of rejection, and then to manage potential metabolic conditions that can come about in the long term. The advancement that we have currently is that we no longer need to have the same blood group for donor and the patient. We can transplant across blood group because we have stronger rejection medications.
Many thanks for sharing your experience with us. Viewers, we got to know about liver issues, common liver issues, and liver transplantation process a bit from Dr. Louis. It's time for a break. Stay with us. Hello viewers, welcome back to Doctor's Voice. On this part, we'll be trying to know about common cancer condition from Dr. Tanuja Rajasekaran. Dr. Tanuja is a senior consultant medical oncologist at Parkway Cancer Center. She is experienced in general medical oncology with subspecialty interest in the management of lung, genitourinary cancers, and head neck cancers. Previously, she served as a consultant in National Cancer Center, Singapore, and as a medical director of the Changi General Hospital Cancer Unit. Hello, Dr. Tanuja. Welcome to our show.
Thank you so much for having me.
It's our pleasure. So, as we got to know, you have a special interest in dealing with lung cancer patient. In this part of the world, it is a very predominant cancer. So, do you think the incidences are increasing nowadays for lung cancer?
That's a great question. So actually worldwide, the lung cancer incidences is actually coming down, and that is really because of all the tobacco campaigns that have been ongoing for very, very many years now. But the interesting fact is that lung cancers that are due to that are non-smoking related are actually increasing. And that is something that that is something that that we need to focus on actually.
So you mean to say that lung cancer can happen in non-smoker as well?
Absolutely. Okay. So, I mean, for most of us, whenever we think of lung cancer, we think this is a purely smoking-related disease, is a disease associated with men who smoke. But this is absolutely not true. And increasingly, what we do see is lung cancers in non-smokers, in females, and in younger men who have never smoked before as well.
Okay, so can you shed some light on the earliest symptoms of lung cancer?
So different people can present in many different ways. So lung cancer affects the lungs. So some people may present with lung-related symptoms such as cough, difficulty breathing. They may have wheezing, or sometimes they may notice blood in the sputum when they cough. Or sometimes they may have very generalized symptoms like loss of weight, loss of appetite, or they may have symptoms related to the spread of cancer to other parts of the body, because lung cancer is notorious for spreading to areas such as the bone, to the liver, and to the brain. They may have symptoms related to that. So for example, they may present with bone pain, or they may present with headache or giddiness if the cancer has spread to the brain. But more importantly, there are a lot of patients, they actually have no symptoms of lung cancer until it is very late. So the problem, one of the biggest problems with lung cancer is that it tends to be diagnosed at a very late stage, because most patients do not have any symptoms when lung cancer is at its early stage.
That is a bad message for our patients and common people. So what about the treatment options when a lung cancer patient diagnosed?
Okay, so it depends. So treatment options really depend on the stage of the lung cancer. So usually when a patient is diagnosed with lung cancer, we would do specific tests such as we'll get a biopsy to confirm the presence of a lung cancer. We would do scans to see what stage the cancer is in. So generally for early stage lung cancer, which is stage 1 and 2, patients are usually offered surgery, and post-surgery, depending on the type of cancer they have, they may be advised for post-surgical treatment, what we call adjuvant treatment, which may be chemotherapy, which may be immunotherapy, or even targeted therapy. For patients with more advanced disease or metastatic disease, treatment options would include either chemotherapy, immunotherapy, targeted therapy, radiotherapy, depending on the type of cancer they have. And how we know this is usually after we have taken a biopsy of the lung cancer, we would send the tissue for molecular testing, and we specifically look for something called driver mutations to find out if there's one particular mutation that is driving the cancer, and if we find that particular mutation, we can target it with a specific drug. So this is truly precision medicine.
Precision medicine, and it must be a recent advancement on this field. So you were saying about targeted therapy and immunotherapy, for which we must need to have some molecular testing of the sample taken from the patient's lung. Is it a preventable disease? Do you think so?
So some lung cancers are preventable. So lung cancers that are smoking related, definitely preventable. So if you smoke, definitely quit smoking. If you have a lot of exposure to secondhand smoke, please avoid that. And research has shown that even if you've been smoking for many years, once you quit smoking, your risk of lung cancer decreases. However, there are other types of lung cancers that are not smoking related. At this point, we don't really know what's the cause of these lung cancers, so we may not be able to specifically prevent it, but I think taking a general approach to our health to prevent any sort of cancer for that matter would mean a healthy, well-balanced diet, getting lots of exercise, and I think just a general healthy lifestyle would be needed.
So for some of the cancers, they are screenable. Some of the cancers like colon cancer sometimes, or cervical cancer. Do you think can we screen for lung cancer?
Yeah, so that's a great question, and this is really some new data that has come out. So what has been found that is among men who are within the age of 55 to 74 and have a prior smoking history, research has shown that if they go for annual screening with a low dose CT scan, their chances of lung cancer being detected early is much higher, and it's been shown that if they do this decreases the risk of lung cancer mortality for these men.
Okay, so that can be offered, low-dose CT scan as a screening tool. So now I'd like to know about some common genitourinary cancer you deal with, particularly from this part of the world.
Okay, so maybe I'll start with by saying what exactly are genitourinary cancers. So genitourinary cancers are any of the cancers that affect the urinary system. So it may include the kidneys, the bladder, the ureters, the testes, the prostate. But among these cancers, the most common is prostate cancer. Worldwide, prostate cancer is the second most common cancer in men.
Okay, so even in this part, prostate cancer is a very common cancer. What are the common risk factors for getting prostate cancer?
Okay, so the most common risk factor is age. So prostate cancer is a cancer of older men, so the risk of prostate cancer increases as you age. Other common risk factors are things like having a family history of prostate cancer. So if you have a father or brother with prostate cancer, that increases your risk of prostate cancer. Certain men have inherited genetic mutations, particularly the BRCA mutation, and that increases the risk of prostate cancer as well.
Okay, so what may be the early symptoms of prostate cancer? As you know, we have a common prostate condition, that is benign enlargement of the prostate. Can it camouflage the symptoms of prostate cancer?
You are absolutely right. So maybe I'll start with what the common symptoms. So people can present with urinary symptoms. We usually term these symptoms as lower urinary tract symptoms, and so patients can present with things like difficulty passing urine, or when they find that the urinary stream is very weak, or even after passing urine they still have a sensation that the bladder is full, or sometimes they may even find blood in the urine. These are all the lower urinary tract symptoms. Patients can also present with what we call constitutional symptoms or general symptoms, where they have loss of weight, loss of appetite, and prostate cancer likes to go to the bones. So I personally, as a medical oncologist, have seen many patients come to me with back pain, and essentially at the end of the day being diagnosed with prostate cancer. So you're absolutely right about prostate cancer and benign prostatic hypertrophy having very similar symptoms. So they have symptoms, the same lower urinary tract symptoms. How we would differentiate both would be, we do the PSA testing. So in prostate cancer, PSA levels may be much higher. Also, we would do specific scans like the MRI of the prostate, which will help to differentiate between prostatic cancer or just benign prostatic hypertrophy. And if the scan shows features that are suspicious for cancer, then we would advise patients to go for a biopsy to confirm whether there's presence of cancer.
Okay, so to establish the diagnosis, we again need a tissue sample, that means biopsy. So about the management options, how do you offer management for such diagnosed prostate cancer patient?
So again, with prostate cancer, treatment would depend on the stage of the prostate cancer. So if it's early stage prostate cancer, meaning that the cancer is localized to the prostate gland, there are 3 treatment options available. So one would be surgery, another would be radiotherapy, and in certain patients, depending on the type of prostate cancer they have, one of the options is active surveillance, meaning that these patients may not need upfront surgery or radiotherapy, but what can be done is these patients will need to be followed up very closely with their physicians. They would need to go for regular repeat biopsies every year, repeat digital rectal examinations, as well as scans to make sure that the cancer hasn't changed to something that is more aggressive, that would need more aggressive treatment like surgery or radiotherapy. For patients with advanced prostate cancer, meaning that if the cancer has spread to other parts of the body, then treatment is generally systemic therapy. Prostate cancer is a cancer that is driven by hormones. The hormone that drives prostate cancer is testosterone. So usually what we do is make sure that we try to get the testosterone levels as low as possible, and that is called androgen deprivation therapy. And there's many ways that we can do it. Either we can do it medically by giving patients medications to take, or they can go for a surgery to remove the testes.
Okay, so we're at the end of our show. Leslie, what is your message for our common people regarding cancer?
So cancer is something that is unfortunately going to become a disease that's very common as our population ages. We expect 1 in 3 or 1 in 4 people to develop cancer in the long term. So be aware of potential symptoms, be it lung cancer, be it prostate cancer, or any other symptoms. So if you have any of this, if you have any worrying symptoms that you are concerned about, please go and see your physician. In terms of screening, make sure you're up to date with your screening in terms of getting your pap smear, your mammograms, colonoscopies, and if in doubt, just speak to a physician, and more importantly, have a healthy lifestyle.
Many thanks for your message. Many thanks to both of you, Dr. Tanuja and Dr. Louis, for being at our show. It was a pleasure talking to you, and I believe our patients and our common people will be highly benefited from your messages.
Thank you for having us.
Yeah, I wish you have a safe journey back to Singapore.
Thank you.
Thank you
very much.
Thank you. Viewers, that's all for today. On the next episode, we'll be discussing about some other health issues. Till then, stay fine, stay tuned.